Good morning, good afternoon, good evening, everyone. You're welcome to today's episode, which is a collaboration with Public Health in Real Life and United Vessels of Love U-VOL Foundation, where we have a maternal health series. On today's episode, we'll be highlighting addressing the maternal health disparities in the US, and we have a fabulous array of speakers to talk on this very important topic with us. To introduce our speakers, I would like to just share a quick run through of their bios. We have Dr. Nikita Bus, who is the owner and CEO of Six Dimensions. She's a certified woman-owned, which is a certified woman-owned, minority-owned public health research, development, and practice company. She's been a servant in the public health field for over 15 years, and she's also the executive director of the short documentary Laboring with Hope. The film highlights the issues of maternal morbidity and mortality among Black women. Laboring with Hope is also being used as a call to action to implement, support, and uplift strategies that aim to improve maternal health and birth outcomes. You're welcome to today's episode, Dr. Burse.
Thank you. Glad to be here.
Next, we have Dr. Kobe V. Ajayi, who is a health system and health policy scientist and consultant with over 15 years of professional experience in academia, private sector, and the nonprofit sector. Dr. Ajayi holds a PhD and a master's in public health in health behavior and health policy from Texas A&M University. She has several years of experience volunteering with NGOs working at grassroots level to promote maternal health through health education and provision of safe birth kits to community health centers. You're welcome, Dr. Ajayi. And lastly, we have Dr. Oluwatoyosi Afolabi, who is a physician and master of public health student at Northern Illinois University. As a public health professional, she's very passionate about contributing her own quota to make a difference. She's worked with various nonprofits over the past 6 years and recently worked on a USAID funded project aimed at reducing HIV prevalence and also worked on a lot of prevention of mother to child transmission of HIV in Nigeria and other countries. Toya today will be sharing her experience from a patient perspective as well as from a public health perspective. You're welcome to today's episode, Toya.
So much. I'm glad to be here.
So just kicking us off, some of the stats that we've discussed about maternal health disparities in the US and specifically Black maternal health. CDC reports show that a Black woman is 3 to 4 times more likely to die from pregnancy and its complications than on average than a white woman in the US. And this is death, which is the mortality. We haven't even talked about the morbidities and how some of those are mentioned. And it's known that over the last 2 decades, the overall mortality has been increasing in the US and of course disproportionately more in the Black community. Dr. Burse, I know a lot of your life's work is really centered on this. Why could you tell us what's happening basically and shed some light on the stories and why this is important?
Yeah. Good morning, everyone. And again, thank you all for having us for this timely discussion. Um, I don't think what we are seeing is new. I think it is, but we are thankfully shedding a bigger light on it, and so then more resources are being directed to the issue of maternal health, maternal morbidity, and mortality. So what's happening is very complex, and it's really almost a little bit counter to what we see in our training as public health professionals. So if we're in an academic or a learning setting, then we're given all these risk factors. So maybe that's comorbidities such as hypertension, obesity, and all those things that are very clinical focused. But to really understand this maternal health issue, we have to look at, of course, what we call the social determinants of health. And so then that's our environment, where we live, work, and play, transportation, the access to health care, all those things play a role. But then if we want to peel that onion back a little bit more, we still have to look at this systemic racism and the institution of racism and how it has created systems in this country that do not benefit Black women. And so the systems that we live in and navigate daily, and I'm not just talking about the healthcare system, because we hear a lot and we put a lot of this on the healthcare system. The system doesn't listen to Black women. That is all true. But we also have to look at those other systems that we as Black women navigate daily. So that's workspaces. Do we have access to economic security, upward mobility, so that we can take care of our families in a way that we would like to? Are our communities safe? Do we have access to healthy foods and all of these? Or do we even have a stable home? And can we get a loan to purchase a home? And so all of those things are where people may say, okay, pull yourself up by your bootstraps. We hear that all the time. But reality is that the way the systems were designed, they were not designed for us to be able to even have the boots to pull up. And so that's very glaring in this. And so I'm glad that we continue to shed light on it. But the issue is, how do we dismantle it? And I don't think we as Black women dismantle it. I think we have to figure out ways to continue to navigate it until this light bulb or great enlightening comes, where this country wants to truly address racism and systemic racism relative to Black maternal health.
Thank you for shedding that light and really highlighting a lot of those like root causes. Like you said, it's yes, the numbers, but then we also have to think about the determinant factors, social determinants of health. And I'm a strong believer in really looking at the stories behind the numbers. So speaking of stories, Dr. Afolabi, please share your experience with us.
Thank you very much. And thank you, Dr. Burrs. I really liked when you mentioned that this is not something new, but it's like getting worse. It's like there's fire on the mountain, and it's really very, very sad that this is still happening in 2023 in a developed country. From my experience, so I came to the United States last year, and that was in 2021, 2 years ago. And by then I was pregnant. So after giving birth to my baby in the hospital, and so I came along without my spouse, and so I only had like my friends to support me. I gave birth March 22nd, 2022. And after giving birth, I was discharged the second day following the delivery. On getting home, I started having fever, but I just kind of like just felt that, oh, probably it's nothing. And but then my friend who was with me insisted on checking my temperature. Upon doing that, I was 105 Fahrenheit, and she insisted on us going to the hospital. On getting to the hospital, everything became worse. I was almost unconscious. My blood pressure was about 200 120 thereabouts, and at the same time I was almost like losing sense of where I was. So I had to be admitted after undergoing several investigation, and it was found that I had like an infection in my womb. So I had to be admitted immediately, and I was started on antibiotics. But at that point in time, I also had like various complaints, and I noticed while on admission, I didn't have access to like a doctor. So kept on, the nurses kept on, I kept on communicating my complaint to the nurses, and then they keep telling me, oh, we'll communicate that to the doctor once the doctor is back. That was within 24 hours. 48 hours later on, I was yet to be seen by a doctor. And at that point in time, I was getting worse as well. And I was getting very worried. Fortunately, my friend came in after like about 48 hours, and then she asked me if I had been seen by a doctor. And I told her no. And at that point in time, she was very furious, and she went over to the nurse's station. And I had a lot of screamings and all. But the good thing is that within like 30 minutes afterwards, I was seen by a doctor. And I just keep on wondering what would have happened if, and by the way, my friend is a white person. I just keep on wondering that probably I could have also like been added to the statistics. And because I felt that this is probably what most Black women out there experience. And this is part of what is contributing to this situation. I don't know if not being seen by a doctor is like, I mean, I can't conclude if that was because of like racism, but it was very interesting that after like 30 minutes of my friend going there to insist on I getting to see by a doctor, I was seen by a doctor. So it really calls for a lot of question that what exactly is happening? Why are Black women treated this way? Because I do believe no women should have to die or undergo complication from giving birth to a life, from welcoming a life to this world. So it's really begs to us like a lot of questions to be answered and then urgent need for an intervention.
Well, thank you so much for sharing your story, Dr. Afolabi, and listening to it. It's it takes a lot to not only experience that, but to share your story. So thank you for that courage and for sharing it. And there are way too many stories. We hear these stories in the news, but like we said, there's power in storytelling. And thank you for shedding the light on a lot of those issues. Dr. Burst, like you said, there's a lot of factors that contribute to it, even outside of the health system. And the burden is not necessarily on the health system to address these disparities, like social determinants of health and all that. Dr. Colby, I know you are in transit, but wondering if in all of your research that you've done and your years of experience in addressing maternal health issues and Black maternal health issues, you can weigh into some of what the literature says and what you've also uncovered from your work as to some of the root causes and what has been done to address these root causes.
Hi, I'm trying my best to make sure. I hope. Um, okay, so thank you so much, and oh, such a very powerful story, and thankful to see that you're well, and it's just a very pathetic story that tends to happen too often. Like you mentioned, in my experience, I've had the opportunity to work across with mothers, particularly Black mothers in the NICU, who have, that is a neonatal intensive care unit, who have had babies, with either preterm or full-term infants. Now, the thing, the panelists have earlier mentioned, there are really diverse issues, not just one particular issue. We can't just attribute, we're not attributing the whole maternal health crisis to one particular issue, because there is a policy level issue, there's a systemic level issue, there is a community level issue. So if we look at it from the ecological model, we see that policy side of things, there are issues where, for example, the Roe v. Wade that has been passed. When we look at from the community level, we see community-based organizations that do not get funded, for example, especially those owned by Black mothers or Black communities. Or we see the disparities between how community work hand in hand with the hospital systems. And also when we're talking about accessibility, right? Sometimes we forget and think accessibility is all about health insurance. It's already obvious. The United States insurance level for access to health insurance is way lower in the United States compared to other high income countries. So when we look at health insurance, the fragmentation of healthcare system in the US, just even to navigate from point A to point B is so complex that it makes women really to be in the cracks. And when we will talk about Medicaid, right, there is states that haven't expanded Medicaid, for example, and you see some states really having very high per the poverty threshold. You literally can't even be amongst people who would have access in the first place. So these are all a combination of several factors, like I mentioned, across the ecological model. And again, in most of it in my research, you see my research, what I've actually seen a lot is among Black mothers saying the same thing over and over again. A, they're getting neglected, nobody's listening to them. B, there are issues concerning their being undermined, as in one case, I'll tell you a story. The lady said she literally had to tell them, like, hey, speak to me. I have a biology degree. Speak to me as a human. I understand your language, right? Just so that she understands, so just so that they really take her seriously, take her claim seriously. So in all of this, there are lots of these are a lot of issues that we're looking at. And of course, there's issue with data, right? We don't have reliable data in as much as Black and African American maternal health outcome is really, really bad. What we have seen as well is we need disaggregated data around Asian populations, for example. We need more data around robust data for American Indians and natives. These are people who the data already shows that they also have negative and adverse maternal health outcomes. But again, data to really allocate resources properly and to really know which to allocate resources and to really understand the trends and patterns across their health outcomes. As there are a lot of you talked about the interventions or things going out there. There are quite a number of things going out. Recently, I think yesterday, the NIH just announced like three major. Yesterday, the NIH announced like three major funding stream for three major components. There's one that has to do with postpartum depression. It's that one is highlighting health. That one is highlighting and knowledge and sharing experiences of mothers. I know one is towards improving funding for research, and the third one is, I think the third one is part of the Momnibus Act of 2022, like it's an extension of that. So that just got released yesterday, so I'm still here to do my proper digging into that. So there are quite a number of activities going on, although we need more, we need it to be faster than, we need it to be proactive versus to be reactive, right? Yeah.
Thank you so much,
Thank
Dr.
you.
Ajayi. This is really informative. And, you mentioned something which is really important where you talked about its multifaceted problem. And also, it's important to note that, yes, the maternal health disparities disproportionately affect the Black community more, but it affects everybody because the US has one of the worst health indices of the developed nations, less return on investment on the health investments per capita. So there's incentive to address this equity issue. You also talked about, at the different levels, even like community-based organizations. So Dr. Nikitra, over to you. I know as the CEO and founder of Six Dimensions, you've done some work. So could you highlight some of the challenges and even successes, because we want to talk about bright spots and how those could contribute to, addressing this issue?
Yeah, thank you both for just, I was over here like going to town, writing down things because those are many of the things that we see, of course, in Mississippi. And so one of the biggest things that we are seeing that was already mentioned was around Medicaid expansion. And Mississippi is one of those states that has not expanded Medicaid. And so to layer on top of the work that we're already doing, trying to meet needs in the community and understand where the problem is from a community level or community perspective, is trying to advocate for access to healthcare, and not just access to healthcare, but access to quality care. And so one of those things, of course, is advocating for Medicaid expansion. But on the other end, we have spent the last 2 years just advocating for the extension to the postpartum extension to 12 months postpartum for women. And so that was just signed in our 2023 legislative session. And so those things are important and they really layer our work. So much of what we have done, and I think I want to talk a little bit about the work that I'm doing in partnership with another community-based organization, Magnolia Medical Foundation. So for the past several years, we have worked on trying to understand what women and Black women in particular feel like they need. Like, we know around the big picture issues around racism, but when you don't have access to healthcare, when you don't have transportation, you're not thinking about a policy. You're thinking about the day-to-day things that have to happen to get the care that you need. And so we have tried to figure out, okay, so what are those things that we can do to, one, help women navigate this complex system that has already been discussed, and where can we fill in the gaps to provide those wraparound services in one place. And so what we're doing right now is we've done like 3 years of kind of formative research, a little bit of pilot here and there. And so now we're piloting on a larger scale. There's a diaper bank food pantry that also gives baby food. So that's a woman's, and this is a clinic type setup. That's a woman's kind of first entry there because it's situated in the community. And so women come directly in for diapers. That one thing alleviates the financial burden. We know how much diapers cost. And so then when they get there and they get those resources that they need, then the next thing is they get kind of this intake where they talk with a social worker to really understand what's going on and try to create a treatment plan for them. And so that treatment plan includes, do you need a doula? And if you do need a doula, we have a doula right there, two doulas that can support, and childbirth education. Those things are happening there. So that also helps to kind of provide that protective factor, if possible, in the healthcare system. And then mental health. The funding keeps going toward mental health, and we see that, and the numbers dictate that as well. And so having a mental health provider there that they can go to, whether that's virtually, one-on-one, or in a group setting. And so all of those things, they're able to just continue to cycle through this. So every woman may not need all of these services, but she may just come in and need help finding a job. So those are resources that we can kind of connect her to. And the thought behind that is, let's try to alleviate as many of the barriers that as we can, so that you have a clearer mind when you're navigating such a complex system. And then you also have additional supports when navigating the system. And so that's kind of a community, I guess, intervention that we're using to really understand the system and help people navigate the system as well. So I'll stop there because I can go on and on about all the things that we're doing, but it seemed fitting in the context of the conversation to try to highlight what we're doing really on the ground and how we're connecting people to resources when these big systemic barriers are just so glaring.
Mm-hmm. Thank you, Dr. Burrs. Wow, like you said, we could go on, and I think we're contributing our own quarter to just really shedding more light on the issue, and not just shedding light, but advocating for the work we do and highlighting the work that like researchers like Dr. Ajayi, community mobilizers and organizers, and then patient advocates and providers as well, like Dr. Afolabi are doing. So back to you, and again, thank you for the courage to share your story. Your story is all too familiar for many. Some people are not here to tell the story. I still read, the story of a mother who even had positive affirmations of her board of what she wanted, and the fact she advocated for a doula, and that she wanted a provider that looked like her. And yet all of these things failed, and she ended up losing her life despite walking into the hospital. And this story is shared across different socioeconomic levels. Serena Williams has shared her story. We have the unfortunate passing of Tori Bowie, where we would never know what happened. And Alison Felix penned something, in the New York Times, talking about how even within her family and community, people didn't know that the fact that her feet were swelling and all could be troubling signs. And she almost lost her baby and eventually, and who knows, maybe her life. So again, these stories are all too familiar. From a provider perspective, what do you think providers and the system can do to address this issue?
Thank you for the question. It's very sad, like hearing the stories of these different women cutting across like various socioeconomic level. It's very sad to see that this is the something that it's the ongoing, and hopefully we don't have future numbers adding to future people. I mean, people in the future adding to that number. And as regards what providers can do to be able to like address this, it's also very unfortunate that there's institutionalized racism even among healthcare providers. I know in the 18th, 19th century, the main issue regarding like maternal health then was involving Black women in experiments against their consent and against their will. But this is 2023, and even though that's not the case right now, the cases of Black women dying from just wanting to give birth to another life. And I think one of the ways that this can be addressed is by involving healthcare providers in training as regards like training against like racism. Just to give more context to that, I'm aware that the American Academy of Pediatrics has a global health, racism, anti-equity, and decolonization training for pediatricians. So just trying to like imagine if maybe every association, maybe American Academy of Dermatologists, Orthopedics, and all, if they have that kind of platform, and if possible, probably compulsory for members, that's going to go a long way in terms of addressing like racism, systemic racism among healthcare providers, because systemic racism does not just affect patients, but it also affects healthcare providers as well. It affects patients in the sense that there have been studies showing Black women having like mistrust in healthcare provider judgment. There have been stories of Black women refusing to like adhere to like medication just because of like judgments from healthcare provider. And I also read somewhere online of where two babies were born, a white baby and a Black baby, and the Black baby was subjected to like further like testing for drugs, and that wasn't done for the white baby. So these are some of the ways in which like racism from healthcare providers can also affect patients. And in terms of also like healthcare providers as well, systemic racism will result into improper decision making in the aspects of the patient. There have been stories whereby women feel like neglected, or like what Dr. Buss said earlier and Dr. Kobe, of like women not feeling that they are heard, not being listened to. And that's because when there is like already like a passive systemic racism from the part of the healthcare provider, they tend to not provide patient-centered care, or tend to see the women as being their patients and being able to like uphold like their rights. So I think a system whereby there's continuous, I deliberately make use of the word continuous because it's so easy. There are so many trainings online that people will just do for like CME, but this should go beyond like just being able to get like continuous medical education points. This should be something that maybe is done maybe annually, and maybe it's also done to be also like evaluate like healthcare providers. That will be kind of training whereby healthcare providers will be able to like have like value clarification as regards like racial profiling, and also like other things as regards like systemic racism. I think this will go a long way in terms of like addressing the issue of maternal mortality from the healthcare provider perspective.
Thank you, Dr. Afolabi. You listed a lot of issues. Dr. Ajayi, I know you have a lot of experience with like NICUs in the US and trying to understand barriers and solutions. So, are there lessons learned from your research and your study that you think could be applied specifically to address the maternal health issues?
Yeah, thank you so much. Dr. Falabi mentioned quite a lot of areas, touch points where definitely interventions we can always leverage to improve maternal and protect maternal health. One, in all of this, I'm just going to add on to what she's saying is the whole idea when we're looking at it from a policy level, right? Fragmentation of care isn't working. Mothers, they see different diverse healthcare providers, right? They see their OBGYNs, they see their PCP, their provider. They also see pediatrician by the time the baby is born and things like that. What about if we don't only focus on the OBGYNs? What about we focus together? We bring everybody together to the table to have this discussion, and even behavioral health, like psychiatrists, because of the fragmentation of care and because of how delicate and unique the period of having a birth is, that pregnancy and that whole period is, sometimes even the providers don't even know who to attend to the mother. Like they're like, okay, I just gave birth to, she just had a baby and that's it. Like I'm done with her for now. So in my research and in my work, one thing that is really, really important is having to dignify the mothers, right? These are humans, these are people. Dignifying their care, respecting their birth plans. Sometimes we see some of these things like, oh, it's subjective, and unfortunately, traumatic birth experience can be seen as subjective, which sometimes makes it negligible. So a mother having an unplanned CS could be traumatic for her, whereas maybe she had already had a miscarriage and she didn't see the miscarriage as traumatic. Because we are all different, it's subjective. So having, in as much as one thing that I know that is really important is having measures. What are we measuring, right? Well, are we measuring just to measure patient experience to get hospital ratings? Or are we measuring to measure to ensure that we are really improving on our standard? The quality of care. So data, continuous quality improvement is really important. And we need to be able to measure across different aspects of care. So in my research and my work, that has been something that is really key, that has stood out to in my work and even in the people, the words, the discourse I've had with mothers. Continuous quality improvement, accountability, and having to dignify mothers, right? We need to hold the system accountable, and we need to have dignified, respectful care for the mothers. If a mother say, hey, this is my birth plan, it's the job of the provider to listen and walk through the birth plan with the mother, versus just looking at the birth plan and say, hey, I know better than this, you're saying it's crap. It's possible that some of the things the mother have said, because of cultural beliefs and cultural norms and just the way their own beliefs, this is something that is attainable for them. What the provider is meant, the duty of the provider is at that point to walk through it together. They have a discourse. How is this important to you? What should we do? Things like that. So those are just that negotiation, decision making, shared decision making is really important. So that's all. Basically quality improvement measures and quality improvement measures and shared decision making and dignified care. Those are part of the things that can really abate the adverse birth outcomes in the US.
Speaking of data, quality improvement, respectful care, and all, in this age of artificial intelligence and digital health, Dr. Burrs, how can we leverage technology and innovation to improve health outcomes, not just for Black mothers, but for women in general?
So, yeah, that's one thing I'm very encouraged by. Is the use of technology. So I've seen many apps come out that can support families. So like there's an app around breastfeeding. I think it's called the Pacify app. And many Black women have created other apps. I think the Earth app helps. I think it kind of ranks providers. So there are applications there that support that. My worry also, for a rural state like Mississippi, we still have many broadband issues, access to care, access to even internet issues. And so even the influx of telemedicine and how telemedicine has really started to, I guess, kind of help us shrink some of those disparities, is still a barrier in very rural states like Mississippi that have broadband issues, where people don't or unable to use their data on their phone to for their health care. So I'm definitely encouraged. I've seen a few things around equity and AI and things like that. So really hoping that as it advances, that we still aren't left behind, or these technologies aren't used to further create disparities and inequities for our families. But I am encouraged by the use of technology. I think the equity has to be in the conversation early on, though.
Yes, equity definitely. And the whole talk about artificial intelligence and digital health sparks the debate of do we run the risk of further enlarging those disparities, because again, some of those root causes are not addressed. But we will stay hopeful and positive. And before we move to solutions and recommendations and research, we want to take audience questions. We have an audience question that talks about, and I think this is a great question because this is further going back down the pipeline to the issue you addressed, Dr. Afolabi. How can medical schools and health education, because that means nursing schools, midwifery schools and all of that, how can the education be improved to ensure that we can achieve health equity and improve patient outcomes?
Thank you for that question. Before I proceed to answer the question, I'd just like to give a background on something I did while in medical school. So while in medical school, I was involved with the International Federation of Medical Students Association. And while working with this association, that's like the body of medical students, like worldwide. And while working with them, I realized that not just Nigeria, where I had my medical education, I realized that several medical school curriculum, they are just focused on addressing um, clinical management of women who are victims of gender-based violence. And I was kind of furious about that. I was like, why can't they go beyond that to also like train us as regards like how to even prevent gender-based violence in the first instance? So a friend and I came up with like a workshop, a curriculum. We tagged it Violence to Victory, V2V, that was targeted at empowering medical students on how to be advocates against gender-based violence. So beyond the clinical aspects of gender-based violence like management, we talked about how medical students could be advocates against gender-based violence, how to prevent it, how to identify it, and how to also do advocacy generally. And this training has been carried out in about 5 different countries in Africa. And I feel as regards like Black maternal health mortality as well, I feel there's that trainings should go beyond just making healthcare provider to just like understand the clinical aspect of it. There's more to it, like what Dr. Bruce and Dr. Kobe mentioned earlier. Some of these things are multifaceted. There are several factors or determinants of health contributing to maternal mortality in Black women. And I feel the medical education should include as part of the training, like a general like background as regards like some of this issue. There should be a bit of this of training as regards like the social aspects of even as regards like how social healthcare providers could also like work to also like prevent some of these issues, and also as regards like being able to also identify like some of the systemic racism, and training healthcare providers, social healthcare providers on how to prevent like racial profiling and also like racism in their practice. If this could be implemented early enough in all medical schools in the United States, I see a very bright future for Black women as regards maternal health. And I think this will really go a long way to be able to like address the issue of maternal mortality among Black women. I hope that answers your question.
Oh yeah, no, that's amazing. We do have some other questions in the chat box that address advocacy because you had touched on advocacy. But Dr. Burst, I don't know if you wanted to weigh in on this.
Yes, just very briefly, I agree with everything Dr. Toyo said, and we see that as well. So our angle has been that we don't just focus on the current providers because they have already gone through this system, and then they already have their, our own biases that we bring to everything. And so we have developed a course that addresses many of the things that you stated, Dr. Toyo. It starts from incorporating racism, understanding that history, understanding what has happened in the healthcare system, and how many it's even harder for Black providers just to become Black providers because of the deep embedded racism in the country, and the, getting rid of all of our healthcare institutions, only leaving us just a few, and then making the medical school process much more challenging for Black providers or aspiring Black providers. And so this course that we have, it is complementary to current academic curricula, but we're piloting it now in hopes that it will become an evidence-based course that institutions can embed into their curricula to give some of those things that you will not find in the standard medical education that goes beyond just the clinical factors.
Yeah, so true. The next question we'll take from Mr. Jalen Wright or Dr. Jalen Wright. Apologies. He says, my general question for the panel is, what roles can everyday community members and pregnant persons' friends and family members play in advancing Black maternal health equity efforts? I'll start with you, Dr. Burst, and then I'll go to you, Dr. Ajayi.
First, hey, good morning, Dr. Wright. That's one. I was on his dissertation committee, but what roles can everyday community members? First of all, our part is making sure that the community is educated and understands the issue, that it's not this kind of singular or very hyper focused event, like mom goes into the hospital and she dies labor and delivery, but it's a cascade of events, and it goes across the life course. And so when we have that more global understanding of it, and where we can have community educated around it and around what the supports are and where resources are, then we can fill in the gaps. But I also want to say that we can have all of the family advocates in the world. If our system does not do its part, then we are still fighting an uphill battle. And so I don't want our family members and community members to get so frustrated in their efforts when things don't go away, because it's not, they can't do everything, but we can do some things, such as the education, linking to resources, finding those resources, and even being an advocate going into the system. If you have a family member that's expecting, then, and she doesn't have someone to go to the doctor's appointment with her, go with her, take notes, understand the questions, look at the body language. And so those kind of one-to-one supports are very important as well.
Yes, very important. Next question, addressed to Dr. Ajayi, especially in your work with like research and policy, talks about how well are Black people, and this is from Folonsho Adeola, how well are Black people involved in the policy making process impacting their lives? I believe there should be nothing about the Black community without the Black people.
Thank you so much, Adeola. That's a very important question, right? And this drives the whole idea of the workforce. There's a lot of the percentage of Black African American in the workforce in maternal health, OBGYN, psychiatry. They're really, really low. So when we're looking at how to really integrate Black people, we need to start first from making opportunity for them for that representation. First of all, like the workforce has to be reflective of the community they serve, right? That is one aspect of it. Another aspect of it is the whole idea of just listening to Black people, like listening to Black people, because the voices of Black mothers, the voices of Black women, the Black feminist theory says it, like across the intellect. It's not just the mother who has, or it's not just, for example, we are all highly educated women here, right? People here. It's not just our voices that matters. We only have a perspective of it. The everyday person, like the previous question, the everyday person, the everyday Black person, Black woman, her voice should be listened to across socioeconomic status, across class, across hierarchy. So just really having them listening to Black people when they speak, having a robust and representative Black workforce that actually represent the people and the community they serve is really important. And of course, advocacy, speaking up. Advocacy can mean different things in your own space, in your organization. What are you speaking up in that space? I always use a statement: if we can all make changes in our own little bubbles, we are going to make. By I make my own bubble changes in my own bubble where I am in my locality, you make your own change in your bubble where you are in your locality. By then, by the time we all make different bubbles, we have a big bubbles that we have made changes, that we are really working towards changes. So really, really, and even when we talk about workforce, I'd like to see touch a bit on public health, students in general, right? The young generations of Black people coming up, we need to empower them. We need to make them know what is going on. I'd like to talk a bit of my ongoing study, which actually ties into what Dr. Burns mentioned earlier on and the question that was asked. So the whole idea of awareness is very important. In my study with Black mothers, preterm births, the NICU, something that kept hammering that was just so, I couldn't get it off my head, was the idea that most mothers didn't know what preterm birth was. They hadn't heard about it. Is if they've heard, maybe they've from a distant cousin, family member, and in some cases, some family members have no clue about it. So in that case, it really becomes really, really difficult. So I kept asking, okay, how much do the younger folks, right? I'm not pushing the blame, it's not patient blaming, but at some point we need to be educated, empowered. So when we're making advocacy, we can speak out. We know right? So I'm doing I'm doing an ongoing study right now where I'm trying to just assess Black African American undergraduate students, their knowledge about preconception health, their knowledge about reproductive health, because like Dr. Burst mentioned, it's across the life course. We can't just treat mothers, address maternal health just at the point where they are giving birth. What do we know about their adolescent life? What do we know about everything going? It's a life course approach. That is the only way we can move forward. And currently I'm speaking with young students, 19, 18, 20, and so far it's not been very encouraging. Many of them do not even have never heard about preconception health. They have no clue about what it is. So just that awareness, knowledge, empowering people would go a long way. Thank you.
That's powerful in terms of the lack of knowledge and awareness, and even that far back, because by the time you now get to reproductive age, how do you even know to assess for risk factors? If How do you even know what to advocate for if you don't know what is happening in your body? And then of course when you do advocate, then you're not necessarily listened to, which further compounds the problem. Dr. Afolabi, the next question talks about like the health system and team approach. And this is from Faith Adole. It says, what steps can we take to increase the use of the term team medicine approach to maternal care in the US that includes OBGYNs, nurse midwives, doulas, etc.? And is there evidence to support this team approach?
Thank you for that question. Like since we'll be talking about the fact that maternal mortality among Black women is multifactorial. And at the same time, I also think that for something that is multifactorial to be solved adequately, there's also need for team efforts. This does not just involve like making use of just like the doctors, leaving the nurses behind, but nurses, doulas, midwives, everyone, even to patients advocates and even like community members. Everyone has a role to play as regards like addressing maternal mortality among Black women. I'm aware that there is a Black maternal health caucus that is made up of about 200 community-based organizations, and also like some congresswomen came up together to like form this Black maternal health caucus. And they are also like the one actively pushing for the Money Bus Act of 2022 to be like passed. And I think this is like one of the ways to also show that, okay, people in healthcare can also like team up together to be able to also like advance maternal health among Black women. And at the same time as well, there are also some like community-based organization. Like for instance, I know University of Pennsylvania have like a nonprofit called a center called March of Dimes that is made up of people like doctors, nurses, midwives, and also like clinical researchers, just coming together to be able to like address the root cause of mortality among Black women. This is an example that could be carried out in like various centers, and that will involve like a team approach as regards like addressing the issue of maternal mortality among Black women.
That's interesting that you highlight the different coalitions. It's really exciting and it's inspiring to see so much work that is happening from various organizations, various stakeholders. I think one key thing, and I would ask you all in very quick 30-second responses to talk about how all of these approaches, like how can we ensure collaboration within all of these sectors, within all of these initiatives, so that we can, because there was something you said earlier, Dr. Ajayi, that really amounts to we're greater than the sum of our parts, with each person contributing their own quota. How do we amplify the impact of this outcome? So how do we encourage collaboration and partnership across different sectors? Dr. Burse, quick 30-second response.
I'll go back to what Dr. Kobe mentioned earlier about the funding, how funding is distributed. I think community-based organizations are more than capable of doing the work, and they're already doing the work. But by the time the funding gets to them, it comes federal, then it goes to the state level, and then the community-based organizations are doing so much work for so little money. I think there needs to be more equity in how funds are distributed to give community-based organizations more autonomy and trust them to do the work that they're already doing, and then keep the balance of power between the big funders and the small organizations.
Thank you, Dr. Burst. Dr. Ajayi?
Very good point, Dr. Burst. I would say ownership, right? Ownership. Own it at your level. A mother comes to you at the hospital for care, you own it. Health insurance or health insurers and all, they're trying to navigate it, own it, and try to make sure that whatever you're passing to the next system or to the next triage, whatever you're triaging the care, that you are getting there because you are done, not because it's possible that it's something you didn't do properly or right. So ownership. Own that, see the life of a mother in your care, in your hand, you're holding it, and it's your job before you pass it on. Ownership. Yeah.
Own it.
Thank you.
Do no harm, the Hippocratic Oath. Dr. Afolabi?
Thank you for, I really love the inputs of Dr. Kirby and Dr. Buss. I think I will talk about the collaboration from the point of visibility. Everyone is aware of Black Lives Matter. I feel even if you have someone living in the end of the world, like Black Lives Matter campaign, have you ever heard about it? Everyone will be like, yes, very much aware about it. And I think it is same using like a similar approach. I think it would be very, very important to also like create like more visibility as regards like maternal mortality among Black women. I know a lot of people are aware of like several cases of like systemic racism among Black people, but I feel even within like the Black community, most of those like advocacy and all don't really go in depth into like addressing maternal mortality. Everyone is aware of Juneteenth celebration, whereby it's a day to like celebrate like Black people's life. But I think like using like days like that to also like create more visibility, like across social media platform, and even like in person like events, like advocacy events as regards like maternal mortality among Black women will really go a long way to help with collaboration and also like increasing visibility.
Yeah, I like that. Really highlighting the gains that we have made on some of these various platforms. And speaking of collaboration, this maternal health series were brought to you in collaboration with Public Health in Real Life and United Vessels of Love Foundation. U-VOL is an international healthcare relief nonprofit organization whose mission is to help meet the unmet healthcare and wellness needs of underserved societies. And I have the privilege of sitting on the board of advisors. And as a co-founder of Public Health in Real Life, our mission is to highlight key public health issues, celebrate unsung heroes, and thankfully all of you on this call are not unsung heroes, but we appreciate the privilege to celebrate you all and then really inspire the next generation of providers. So speaking of inspiring the next generation of providers, a quick round of questioning for you all, because I know we're currently running out of time, even though, like you said previously, we can stay on and on. What inspires your work, and what advice do you have for people who want to address maternal health issues in the US? I'll start with you, Dr. Burst.
I will say what inspires my work, number one, is my family. And I didn't get into all of the maternal morbidity and mortality issues we have experienced, but I will allude back to what Dr. Toya said, the visibility that we are getting on the issue. I'm inspired by the number of young people, the number of Black people that are interested in this field and are really committed to maternal morbidity and mortality. That's encouraging to me.
Thank you, Dr. Ajayi.
So what inspires me, of course, it always starts with the family. In case anybody doesn't know, I don't intend to have any child anymore. So even though I won't be going through that, I have two girls, right? They're going to walk this path eventually if they choose to, right? So what inspires me is being that voice. I'm working for them, for the future they have, as well as for other people that look like me, right? To change the course of, to change the story, to change the narrative. And for future maternal health experts or people who are willing to do the work, who are passionate about the work, is do it. Because the statistics is someone, it's, there's a name, there's a face, there's a family, there's a person behind that. 80% of deaths are preventable. There's a person, those are people. That's a child that would never have a mom. That's a husband or a partner that will never see their partner. That's a grandma. That's a sister, right? That's a family. That's someone loved by the community. So do the work and get the work done. Just put on your bootstraps.
Yeah. Dr. Folabi.
Thank you. I would say what inspires me is just to be able to make the world a better place for people. And really, because I grew up in a very like rural setting, and I keep seeing my younger self, and I'm like, okay, this person deserves to have a better life, and so that just keeps me going. And at the same time as well, for other people like listening and watching this, I think one thing is just like believe in yourself, no matter the little thing you're doing. Tiny drops make erosion. So thinking globally and acting locally, you can start doing like little things to be able to like contribute as regards like maternal health. And you never can tell where the little things you are doing, maybe even if like educating others or maybe creating awareness, just telling one more person, that person could go on to tell another person. And before you know it, you make an exchange. So your little quota goes a long way. Just keep being on the move and keep believing that you are also like contributing your quota towards making the world a better place.
We like that. Thank you all for the words of advice. Thank you all for your time. This has been an inspiring session. Thank you all for sharing about your work, the courage to tell your stories and tell us your why. To our audience listening, thank you for your time. Thank you for just, sticking with us. Thank you for your great questions. I would encourage you all to follow Dr. Afolabi, Dr. Ajayi, and Dr. Burst. They do amazing work on LinkedIn, on their social media handles, and please follow United Vessels of Love Foundation and Public Health in Real Life, where we hope to continue to bring, to be a platform where we shed light on issues like this and contribute our own quota. Thank you all so much, and please be on the lookout for the next episode in our maternal health series. And you all be well. Have a great weekend, and bye.